Hi guys, my name's Angel. As the title says, yes, I'm a nurse who is getting her boobs done. Yeah, it's been a long time coming. Pretty much the premise of my video is to help educate you guys on anyone that's interested on doing plastic surgery and kind of seeing like a live review, I guess, live progress videos of getting breast surgery done, and from someone who's a medical professional like me, who's considering like every single aspect of what could go wrong to what needs to be done during surgery. So I won't really be talking super specific about things I'm looking out for regarding my surgery. If you have questions about that, feel free to leave some comments below. I've been a nurse for 2 years, so I'm still a baby. I work on a medical surgical floor in a hospital. I've been flat chested a good chunk of my life since I was about 13 years old. I've tried different things to help my chest size, from birth controls. I did about 3 or 4 of those in my young adolescence from like 13 to 16. I tried a couple, and a common side effect from birth controls is breast tissue changes. So, I did that, didn't work. At one point when I was 17, 18, which I'll admit guilty of, is before I was in school, by the way, so I didn't really know much better than this. I did try the breast creams and pills, breast enhancement creams. That doesn't work. Don't do it. It's a bunch of bullshit. Given as a teenager, I'll do anything to save a couple $1,000s on doing that than getting surgery. So, retrospect, probably wouldn't have done it, but I thought I would give it a try anyway. From personal experience, as well as being a nurse, I highly don't think those creams work, and it's just a gag. About me, I am technically a AA cup, which is technically the bras that you buy when you're like 11 years old and you start to have training bras. But right now I am technically wearing a 36A bra. Very picky with bras because a lot of them that are like cupped and like rounded, I don't fill in because I don't have anything up here. Most of my breast tissue's like on the bottom. So I really can't fill into a lot of bras. What I have right now is a type of like flat padded bikini type bra. So it's not hardwired, it's not cupped or like fully padded. Just thin enough that way you don't see any nips, and it's comfortable. I've thought about doing surgery for a very long time, ever since I was a teenager. Why am I doing it? Because I've always had self-esteem issues, self-confidence issues, because I can't wear a lot of things that any other woman could wear. I can't fill in any bra. I can't wear lingerie. I can't really wear a lot of revealing type dresses or shirts. It's a little bit revealing, but it would look a little bit better with cleavage if you would ask me. So I'll show you what I look like. The bra I'm wearing is like a bikini type bra. There's really no padding whatsoever, just enough that way you don't see anything. So getting closer, I'm pretty bony right along here. You can see my ribs if it was in brighter daylight. The shadowing is actually kind of helping me out a little bit, so thanks, shadows. You can see I'm not really full up here. I do have some breast and fat tissue up here. But you can tell a lot of my breast tissue is kind of down at the bottom. My surgeon said I had about 100 cc's of breast tissue. It was a lot more than I thought. I didn't think I was gonna reach triple digits. But here's an angle for you. I really don't have much projection. So, yeah, that's me. kind of speak too much on the fact of like why I chose what, because again, we would be here for another half an hour. But basically at the end, I chose 400 cc's of gummy bear silicone implants under the muscle and through the nipple as my incision. In the consultation, every doctor is different, but my doctor had a 3D imaging program where they take pictures all around you from side to front, under, to kind of see an overall 3D image of where you are now and kind of adjust what you want in a nice 3D image. So we got to play around with different sizes, and that's where I ended up doing 400 cc's. In my image, wherever I post it, it was technically 375, which is a small side of a C cup. And over time and just, you know, talking to the nurses there, I chose to go a little bit bigger, 400 cc's. It's still a C cup. Really the only difference is the projection. So projection as far as like how much they stick out on this side, you know what I mean? So this versus this kind of situation. Obviously it's a very big difference, but it's more so of how they stick out versus the roundedness. Another side note, my implant is full, like round implant, so it'll be full here, full in the cleavage, full in the bottom kind of situation. I highly recommend, you know, hey, well, which size, which type of implant would be best for me? When it comes your time that you do your surgery, please talk to your surgeon about it, because he's gonna know, he's gonna see your body, he's gonna see what will be fit for you and fit with your, you know, what your thoughts are, what you want. And it's definitely a teamwork process. It goes both ways. So you tell him what you want, he'll kind of tell you what you can do if you can fulfill that. So how did I find my surgeon? So good background story to that. I actually came across Dr. Miami on Snapchat and Instagram about 3 or 4 years ago. I followed him for a while, watching his surgeries. If you don't know who he is, he actually takes live video of his surgery. So it's whether it's a no job, a facelift, doing the butt lifts, breast augmentations, tummy tucks, the whole shebang. He actually does full video of it, no censors. And so it's really nice because he actually educates you. So he actually, you know, like teaches you about anatomy. If you're like a medical student, you know, somewhere in the medical field, he'll kind of talk more in that kind of realm, as well as kind of reaching just the general public who's interested, who just to kind of eliminate the fear and the stigma of plastic surgery and how many people truly get plastic surgery. I still think it's sometimes a taboo thing to talk about when really a lot of people do it. So I followed him, and for a while I was like, you know what, when my time comes, whenever I do decide, I'm going to fly out to Miami, be there for however long he needs me to be there, and I'll do that. And then eventually he started gathering partners of different surgeons around the country, people that he promotes, that he like partners with. And eventually I ran into my doctor, Dr. Carlos Mata in Scottsdale. And I followed him for a good year. I did my research. I looked him up, see what kind of medical school he went to, where he did his residencies, as well as like volunteer stuff that he did. And on top of like kind of getting to know him and the staff and stuff, and kind of I like to have a good relationship with whoever's going to be taking care of me, you know what I mean? I've seen videos myself on YouTube from other people that have gotten their breasts done, as well as what my medical staff have told me, and there really isn't a lot of pain per se, but just a lot more pressure and heaviness on the chest, just because, you know, you have new boobs, you have implants sitting on you, so it does feel heavy and tight, and sometimes you feel like you can't breathe. Hence why sleeping sitting up helps. I'm not allowed to sleep on my side, sleep on my stomach, which will kind of suck because I am a stomach and side sleeper. I love sleeping like that. So I'm going to be sleeping in a recliner in the meantime. And I'm excited to be on the other side of being a nurse. I get to be the patient. I've never been hospitalized, I've never broken anything, never had an IV, so this was my first time experiencing all that. So, you know, I'll get an IV, I'll experience anesthesia, and I've always laughed at the idea of like, I'm not gonna be put to sleep. Excuse me, I burped. I'm not gonna be put to sleep. I'm gonna resist the anesthesia. You're not gonna put me to sleep. So I'm kind of just interested to see what that feels like. I told the nurses, I'm like, I'm gonna be really funny about this because this is my first time doing it, and like I understand their side of nursing and like what they're doing, so I think it's gonna be like really comfortable setting, I guess you could say. So they do put me under light sedation using Versed and Demerol, if any of you out there are aware of the anesthetic type medications. They want to use my experience, one, to help educate those watching this video, as well as like kind of be more empathetic towards my patients. Not that I'm not already, but I like to add a lot of a personal experience to my patients to help them, because a lot of them are also there in the hospital for the first time because they broke something, and you know, whatever situation they're there for, you know, they're fearful of stuff. And I think it's comforting when someone tells you, oh yes, I've been through it before, you know, I had my gallbladder removed too, you know, I had appendicitis too, or whatever issue they're facing. So I'm kind of excited just to kind of be on that other side and be a better nurse in a sense. For what does it look like for work, and what does it look like for post-op? You know, what am I gonna feel like? What are my restrictions? So work-wise, I do work in a hospital. I highly recommend to look into your HR management policies about doing elective surgery. Just because, one, a lot of companies don't like offer disability leave or leave of absence, paid leave of absence, and sometimes your insurance doesn't even cover it either. Mine does not do paid leave of absence, and my insurance does not cover this. So what I had to do is I have 6 weeks of leave, 6 weeks of recovery from my surgeon, and I've basically accrued PTO, and as much PTO as I can accrue to get paid while I'm off work. So I highly recommend, if you're going to do something electively, you know, do your research, talk to management, see what you need to do to plan ahead, because obviously 6 weeks of no leave, that's 3 paychecks. It sucks. So I highly recommend that. Basically with my arm restrictions, I have 6 weeks of arm restrictions. So a lot of it is just no lifting above my shoulder height. So I can't be putting my hair up in a ponytail, I can't be pulling up shirts, you know, I can't be lifting anything, pulling down anything, just because it affects the pectoral muscles here that they place the implants under, which can cause a lot of complications that you don't want to see after plastic surgery if you don't follow those arm restrictions. So it is really important to do that. I'm not allowed to lift more than 10 pounds. I'm not allowed to do a lot of strenuous exercise, more so like lifting, push-ups, stuff like that, for at least 4 weeks. I'm not allowed to sleep on my side, sleep on my stomach, which will kind of suck because I am a stomach and side sleeper. I love sleeping like that. So I'm going to be sleeping in a recliner in the meantime. I'm so excited to do this and finally do something I've been dying to do for a very, very long time. So thank you for following me through this journey. Thank you for watching this video. Please feel free to ask any questions down below. I can answer a lot more specific type questions, you know, depending on your situation and what's going on, versus making a 30-minute video. But I look forward to seeing what the process will look like. Thank you so much for watching, and we'll keep in touch.